So, hello everybody. My name's Elizabeth Shaffer. I am one of the business development managers for Lionfish Cybersecurity. We are a cyber compliance company, and we were built on the premises of buy with and through. We want to empower others with education and understanding. And so today we are going to talk about HIPAA 2025. You don't need to see that. There we go. We're going to talk about HIPAA 2025. I need to fix my presenter view over here. Oops. From the beginning, Schaefer. Okay. So 2025, my name is Elizabeth Shaffer. Previous life, I started out as a supply officer in the United States Navy. So I did federal and naval compliance at that time. And then I did a complete 180 and decided to do one-on-one service and became a medical speech language pathologist. So I spent over 20 years working in hospitals and SNFs and rehab facilities, and HIPAA was a daily part of my life. So that's my background, and we will get started in a moment. But first, I would like my co-presenter, Tom, to please introduce yourself.
Well, thank you, Elizabeth. Hello, everyone. My name is Tom Krause. My background includes over 30 years of enterprise information systems leadership with accountability and systems design, implementation, performance, and risk-based decision making. I've got a handful of certifications, including CISSP, certified in risk, the Department of War's CMMC, and I've got wide range of background, operational experience with HIPAA and ISO 27001, and of course NIST. In recent years, my work has really been focused on governance and executive oversight and risk management.
Perfect. Thanks, Tom. And thank you all for joining us today. We are excited to do this presentation, get everybody up to speed on the gaps that are coming with this. It's called the NPRM is HIPAA 2025. It's still on the books. OCR and HHS are going to be looking at it in May of 2026. I strongly feel this is going to go through, and so hopefully this will give you an understanding of what the cybersecurity requirements coming down the pike are going to be. Today's roadmap, 3 words to remember: now, which is understanding where we are now and what the changes are. Next, what actions you need to take in the coming months, and evidence, how to document compliance and prepare for the audit. Just so you know, this is practical guidance. Neither myself nor Tom are lawyers. We can't give legal advice. We are also not auditors. If you need legal advice or an auditor advice, we do recommend that you find those individuals to help you out. Trying to think if there's anything else on this slide. Yes, we are recording, so you will get a recording of this presentation, and hopefully we'll have an opportunity to speak with you afterwards if you have any questions. Not so sure I'm going to be able to keep track of the chat for questions during. I'll try. We will definitely have time for questions at the end. So, healthcare is under attack. Why does HHS feel like we need to update the security rule? Well, basically, it is the #1 targeted sector for cybercrime. Why? There is an idea that it's more vulnerable and that it's easier to access. And there's also money to be made, right? Criminals want money. So if you look at the bottom of this slide, you'll see that for a complete patient record, it's estimated anywhere from $250 to $1,000 for a full patient record, as compared to 90 cents for credit card information. That is a big jump. Why? Credit card information can change, but there's a lot of medical record information that is forever. My birthday will never change. The fact that I have asthma, not going to change. My insurance might change, but there's a lot of valuable information that can be accessed. Also, you see that 86% practices are non-compliant. They haven't completed a required security risk analysis. This comes from OCR audits, and it's not just the big institutions, but the small ones as well. Accenture and the AMA did a survey. They found very similar numbers, and they were mostly talking to small practices and single practices. So this is why HHS said, we are not protecting the private health information as well as we should. There's too much going on. We need to take care of this. So, for those of you who are thinking, yeah, but I'm small. I don't have a lot of information. I don't have a lot of money. Why would they go after me when they could go to a big insurance company like United Healthcare? You probably heard about that breach, or a big hospital organization. Well, small practices are not invisible. I did a very quick Google search, very, very quick, and said, hey, what are some small practices that have been hit in the last year or two? These are very recent. And you can see there's the first one was a solo gastroenterologist in Utah. He was fined $100,000 because he didn't have risk analysis, because he didn't have a management plan, and he didn't have business associates agreements. We'll talk about all of those things. And it wasn't even his fault. One of his business associates exposed the PHI and he was held accountable, $100,000. The next one is Agape Health Services. It was a small North Carolina healthcare clinic. They mostly served Medicare and Medicaid patients. When it was found that they had a breach, they reported, they did what they were supposed to do. They were audited and it was found they also had not done their risk analysis. They also did not have a lot of policies or procedures in place. They were fined $25,000. And then they had months and months of a remediation plan that they had to follow to get back together. And then this one, Brookside ENT and Hearing Center in, I think it was Battlefield, Michigan. This one is shocking to me. They were hacked and they had ransomware and they were asked for $6,500, which doesn't seem like that much money, right? In Bitcoin. Well, the doctors held the line or doctor held the line and said, no, I'm not going to pay that. And then what they found was that all of their information had been encrypted. They couldn't get to their medical records. They couldn't get to their payment systems. And the whole service had to close down. So everybody, including small practices, are at risk. And this is something to think about. But let's do a quick refresher with HIPAA before we get into the hows and whys of what the new security rule implies. So we all know HIPAA, right? Every year we do the training. Every year we remember what protected health information is, how it's to be handled, and who can see it and why. And that's the privacy rule. We all know the privacy rule. The security rule, which is mostly what we're going to be talking about today, is about protecting the electronic protected health information. So that's patient portals, what's in your EHR or EMR, depending on what you're using, the billing systems, how you handle email, what's in the cloud even. This is what the security role is going to be looking at, and that's what we're mostly going to talk about today. Then, of course, there's the breach notification role. That's something else that we're all trained in. If there's a breach, if somehow our private healthcare information has been accessed, what do we have to do? That's just the refresher. If you have any questions at the end, we can certainly talk about that. And I have actually a resource which I can put in the chat, which is the rule. Oh, no, I can't put it in the chat. I'll send it to you in an email. The rule that you can access, you can also do a quick Google search to find out exactly what is in the new rule that HHS is proposing. All right, next slide. The 2025 requirements. Okay, so this is what the 8 core requirements that we're gonna be talking about today are complete asset inventory, implement required safeguards, manage vendor risk, prove recovery capability, documented risk analysis, test defenses regularly, create incident response plan, and document everything. We're going to talk about each of these in depth. The main thing to remember with this is that in the past, all of these security requirements were, addressable versus required. If it was felt like it was something that you could do, you were supposed to do it. And a lot of, including big healthcare organizations, took that to mean that they were optional. If it was too much money or if they decided it was too much trouble, they didn't have to do it. And so HHS wanted to make it very clear that these are not optional. All of these are required, 8 core requirements. I'm just going to check my notes. Yeah, it eliminates the distinction altogether. And so now we want all of these requirements to be explicit and measurable. It's still scalable. You don't have to have the same pathway to meeting these requirements as, say, United Healthcare or a big hospital, but you do have to address them. We want this to be like the difference between a lifestyle and a diet, not just something that you do once and forget about or put on paper, but something that becomes a part of your everyday experience. And we're going to talk about what these are in plain English. So, okay. Oops, I went too far. Still went too far. Ah. Okay. What do auditors want? It's not perfection. Okay, so those small businesses that were hit with fines and had to do all that remediation, it wasn't because they hadn't done every letter of the law, but it was because they didn't know their environment and they couldn't prove that they were making a good faith effort to take care of the risk analysis, to take care of all of these requirements. So auditors, my previous slide of the three small businesses, the auditor was all cranky. Here's our cute, happy auditor. It's because she knows that the people that they're auditing, they can show the receipts. They have logs, they have screenshots, they have policies in place, and she can and they're showing progress. This is where we were, this is how far we've come, this is where we're going. And that's what matters. Your reality has to match your policies, and you have to have proof for it. You don't hide things or falsify things. If there is one thing I learned about working with the government is they will find stuff. So you've got it all out there where they can figure out how to help rather than how to punish or make it punitive. And that's one of the big differences. And so Tom is going to talk about what it means to show your work. What does this mean in from a policy and a governance standpoint?
Well, thank you, Elizabeth. Uh, One of the things that I've found over the years in working with organizations is that when they look at cybersecurity, they think of it pretty much as a technical kind of thing. And so, patching this or doing a little bit of that or doing training or whatever, and they leave it up to the technical folks or the technical teams generally to make sure that it's done. But one of the things that level of oversight doesn't actually provide for often is the accountability component of it. And as Elizabeth mentioned, the implementation, the measurements of things like policies and controls is listed here on the slides, roles and responsibilities, and risk management, and what does it really take to manage that program? That's the governance part of it. And I think that's where a lot of organizations are probably struggling because it's kind of outside the bailiwick of what their core competencies are. And that's what I've seen over the last probably 5 years of organizations that have really tried to move forward with information security, but they lack the governance part. And as a result, many things fall through the cracks. And then that becomes a risk, part of a risk profile, and then that's essentially where breaches come into play. And so understanding what that governance looks like and how decisions are made, who's responsible for executing, how is the information looked at and reviewed on a regular basis, and then what type of improvements need to be put in place and managed on that time frame on that regular basis. That's one of the key points. And so we're going to drive a little further into that as we move forward. And so this reiterates a little bit about what I just mentioned. Once again, governance is really about how the decisions are made, defines who's accountable, and it's a shift in the mindset because when you look at it through the lens of a technologist, you're looking at it somewhat proactively, but you're looking at it isolated in an isolated environment. Once you implement that governance component of it, you're really you're really making that mental shift and moving towards something that's proactive. And when you're proactive, you can reduce the risk and further invest the resources that you have, whether it's staff, money, or time, in a more effective and appropriate way.
Yeah.
So I'll chat more about that here in a couple minutes.
Yeah, in the end, it's about predictable decisions and protecting your patient care and your patients.
Right.
We want HIPAA, the new rule is about supporting your business. So, what this means for your organization, um, let's basically clarify the roles because the confusion here, confusion causes the most compliance failures. So basically, IT, or if you have an IT department, or if you have a managed service provider, if you have somebody helping you with the technical stuff, they manage the systems, but you own the compliance. The vendors support the controls, but they don't assume the legal responsibility. That's still going to be you. So your governance activities include policy approval and training oversight, making sure you have vendor accountability and taking care of all of that. You want to have your risk analysis. That's a leadership responsibility. And then the evidence ties all that together. You can't just leave it to IT. And it's easy because I know in healthcare, everybody wears, especially in the smaller organization, wears 375 hats, including their clinical hat. And so this isn't about it has been in the past easy to say our IT partner does that. This is just about having your fingers on the pulse of your own business and understanding what's going on. You'll review the reports, you'll complete the risk analysis and that kind of thing. Do you have anything that you want to add to that, Tom?
I think that's right on target.
Okay.
So go ahead.
All right. Well, perfect. Let's do a deeper dive then into each of these new required areas. So the first one is asset inventory and data map. It's about visibility, right? You can't protect what you don't know exist. So basically, you need to know what are all the devices that touch protected health information, or maybe even touch your network. And that could include a tablet that walks around with you. It can include, if you have a remote worker, your iPhone. It could include servers and cloud systems. So you get that asset inventory, and then you figure out where all of the PHI goes, how it's handled, and where it goes. Again, you don't have to do this by yourself. This is a place where your IT professional or your managed service provider, that's where they would put this together for you and you would confirm, oh yeah, this is where this goes. And oh, by the way, we have that old imager in the back or whatever. So then that gives you the visibility. You know where everything is, and this is the foundation for everything else. Once you know what you have, you can put together the policies, you can do the risk analysis, you can update your lists and your records, and you can move from there. So, first thing, asset inventory and data map. Then the next thing is your risk analysis.
And so understanding when you look at those assets, right, and you understand what the data mapping is and how the information flows through your organization, you can get a better idea about whether or not these devices are appropriately maintained based on the new standards. And that process of understanding that and understanding the threats, that is the risk analysis component that really ties into making sure that you are meeting your compliance objectives and that it's measured. And we'll talk a little bit more about that in a couple of minutes.
Yeah. And the thing is, it's not about fear. I do love this slide. I think it's fun. But it's also scary, right? We've got hackers in the background. We've got a big storm that could take out your network and your power. But this is really not about fear. It's about likelihood and impact and management. As with most everything, it's about protecting your PHI and protecting your business. Because if you know what could happen, you can plan for it. And this is where HIPAA becomes operational. So the next slide is, ooh, safeguards. And you're going to see all of these are requirements again. None of this is going to be optional anymore. So the required safeguards, Tom, if you don't mind taking a moment to go through those.
Sure. Yeah, and what I found is that many organizations that they don't have a full understanding of these, and so going through these just at a high level is important. And the first one is multi-factor authentication. Many organizations are tied into Microsoft or some other type of data management platform, and within that, ensuring that you have multi-factor authentication, which is something that you have and something that you know and something that you are. So those are the three levels. And in this case, it could be a login credential and a password, or some type of a code to a device or some biometric kind of thing. So when you're accessing regular accounts, privileged accounts that have additional access, like administrator access, then you want to make sure that MFA, multi-factor authentication, two-factor authentication, is enabled. The second one is encryption. So you want to make sure that the data that you have is encrypted at rest, which means where it's stored, whether it's in some other type of a data management type of a system, making sure that there's protections or encryption protections around that, or in a standalone file, ensuring that the hard drive is encrypted, that kind of thing. And then in transit. So when it's going between a device, whether it's a laptop, some other type of Apple device, or whatever it is, and from that point to the point of storage, that data path is encrypted. And there's levels of encryption, which is a little more technical, so we won't get into those, but ensuring that that's done and implemented. Access control really has to do with who is authorized to look at the data and whatever that data is, and how is that access approved, and how is it managed. So there's a series of controls that are tied around access control, and once you dive into that a little bit, it can be a little complicated, but for the most part, at a high level, when you take a step back and look at it, it makes a fair amount of sense. And then there's network segmentation. Often, if you're at a medical facility, you might have a guest network. Well, that guest network is not tied into your medical production network where all of your equipment resides. And of course, it should be that way. But making sure that the network infrastructure is divided so that there's some barriers between what's accessible by a particular group of folks, whether they're visitors or a particular staff or contractors, versus medical devices or other things. Making sure that the appropriate segmentation is in place. That's now a requirement. Make sure that you have updated software. So just like your mobile device, your phone, you update that on a regular basis. The other devices in your network need to have regular updates, whether or not those are laptops or infrastructure devices like firewalls and those kinds of things. There's a process and a method for ensuring that that's done. Anti-malware, antivirus. Just making sure that gets updated on the appropriate devices, and then and that it's actually there, and then logging. So with every transaction, every event that occurs within your environment, these devices, if they're configured appropriately, they have some type of a record. And so when you start looking at those records and you correlate those records between device A and device B, you can start getting a sense of what's happening within your environment. And if there's some type of a breach and some type of an intrusion within your environment, if those are configured properly, then you're going to be able to more quickly identify what those issues are and how to hopefully address them.
And
So.
just a little commentary, like multi-factor authentication and the logging. Yeah, I think about my times in the hospital, right? And we had to put in our password and to bring up medical records. And everybody complained. Oh, it takes so long, blah, blah, blah. Multi-factor authentication, where maybe you have two steps, everybody, oh no, we can't do that. It really doesn't. It takes 15 seconds, maybe. And it is the single best way to stop data theft. The single best way to put a lock on the data that you have. And so take the extra 15 seconds. And this is, again, not about making things harder for you. It's not about making things inconvenient. It's about protection. Finally, healthcare is catching up to everybody else. Banking, you probably have multi-factor authentication and that kind of thing. So we're just catching up and keeping everything safe. Did you have anything
And
else you wanted to add?
I did, and I think it's important to recognize that a lot of organizations and individuals, when they look at these requirements, and they're thinking in terms of what is happening today, which rightfully so is something to consider. But when you consider multi-factor authentication and what can really what how that can really be implemented, there's a lot of creativity right now around developing uh, the technologies that support that. And a couple of examples would be that if someone is, if a staff individuals, walking through a building, they need particular access to an area. There's technologies out there that can measure the gait of an individual. They can read the pulse and the biometrics of that individual, and then based on that, they can grant access. So it's not necessarily a case where you need to have some physical thing. The biometrics that are embedded in each of our bodies are now being implemented in this multi-factor authentication process. So as technology advances, those things are going to change, but there's still really those three core pieces of something you have, something you are, and something you know that are going to reside and fulfill that multi-factor authentication process.
Yeah, I'm going to take us on a little further. The next requirement is testing. Your network, your systems, they need to be scanned and tested. Vulnerability scans will require twice a year, and penetration testing, where you have somebody pretend to be a hacker and maybe they can get Mary Sue in accounting to click on a phishing link, or making they can get somebody at the help desk to give out information. That needs to happen once a year. Um, your MSP, again, your IT folks can help you with this. If you're a very small operation, you can temporarily hire folks to do this for you, or maybe an hourly basis. You can get contracts and that kind of thing. Um, but this is just, does what you have work? That's all this is. Does it work? And you don't have to do this by yourself. Get help from the technical people. And then vendor oversight. This is a big one, actually. So, plain language, if someone else holds your PHI, you still own the risk. I'm going to say this again. If someone else holds your PHI, you still own the risk. So it's going to be really important to make sure that the vendors that have any access at all to your PHI or could brush against it, you have a business associate agreement with them. It's a simple legal contract. It just defines what compliance is, whose roles are what, whose responsibilities are what, and what the obligations for each party is. And it's going to be really important to have it updated every year. Your vendors will also have to prove that they have training on HIPAA compliance. That's going to be a yearly thing as well, because they're a high risk area in healthcare. As I showed from one of my early examples, it was a business associate that exposed the PHI. So, and again, you'll have to have documentation for this. In a spreadsheet, in a folder, somewhere, you have to have it documented. Yeah, we're doing this. We're taking care of our business associates. And I've got some categories here on the slide of who the business associates are, your technology and your cloud services. So Microsoft even, or Amazon, if you're working with Amazon, billing and revenue cycle, IT, cybersecurity and MSPs, those folks, they could easily get PHI, even if it's not part of their work. Because of what they have access to, they could still see it. Diagnostic and clinical support services, practice operations and admin tools, outsourced staff and contractors. So they'll all have to have BAAs, and you're going to need to make sure that as the practice manager, that these agreements are signed and filed. You own the policies, you own the training, you own the risk analysis, as Tom spoke about. Tom, is there anything else that you wanted to add about vendor oversight?
No, I think that's right on target, Elizabeth. Thank you.
Okay, yeah. And then so the next one, and this takes us into response and recovery. Incidents are not hypothetical. They're inevitable. Something is going to happen sometime. We know that. We work in healthcare. We see it all the time. And so, Tom, talk about how this is part of risk and what's important for keeping things secure.
Sure. Well, on the response to recovery slide, we're really talking about trying to understand what it really takes to recover from an incident. And what I've seen, time and time again in many organizations is that they go through a kind of a superficial process of thinking about, what that looks like, or they've already just decided that they're going to call somebody else when that happens. But the reality is that there are things that organizations really need to have in place to meet this new requirement, within 72 hours of a disruption. And part of that is writing out an incident response plan. And there are
Mhm.
many tools out there that can help organizations figure out what that is and how to kind of move forward with that, with designing that. But once you have that kind of framework in place, then essentially training your team, your
Mhm.
response team on what that looks like, what type of tools they're going to need, what the time frame is to kind of move forward through that process, what the excuse me, what the expectation is with regards to recovery, to ensure that timeline is met. And then once you go through that process, you can get a good feel for for where your holes are. And everybody goes through this process of trying to figure this out, and they map it out, and they have holes and they make adjustments because there's a lot of moving parts associated with that. So once again, there's a lot of tools available to help with that, but ensuring that you have it in place, that you've tested, that you've assigned a responsibility associated with that, and that you've got measurements in place. That's the important part of it.
Yeah, and some things to think about is that you're going to be required to do daily backups. And you got to hold test results for 6 years. They don't just go away. They need to be held in a repository somewhere. Also, if you have to enact a contingency plan because there was some kind of incident, it's going to be required that up and down, upstream and downstream, everybody's informed. So if you are a business associate, you would tell the person that you're working with, and you would also have to tell your business associates, hey, we had to enact this contingency plan. So all of these things are going to come together. And again, this is about protecting your business, protecting your trust and reputation with your patients, protecting your patients. Um, we, the whole idea of the new HIPAA 2025 rule is to make this operationalized and to make it a reality, not just again, a checklist that we check off. And part of how we make this a reality is documentation and training. This is how effort becomes evidence. We are all so familiar with documentation and training. If it didn't happen, if it's not in the chart, if it's not on a progress note, if it's not an evaluation, it didn't happen, right? And so this is the same thing with this new idea with documentation is that we're going to keep track of everything we do with our policies, with our testing, with how we're taking care of our patient information, and we're going to train everyone. So if you aren't already including training about cybersecurity in your HIPAA yearly training, then it's going to be time to start adding that in. And you probably already have documents. You would probably already have a lot of this. HIPAA 2025 is the perfect time to clean up your documentation, to clean up your policies, to make them more readable, to align them with what you're actually practically doing, rather than maybe having a set of documents that sit and gather dust somewhere. Continue your HIPAA training, a little more technology emphasis, and I think you're going to find that you're going to be in a really good place. Tom, did you want to add anything to that?
No, Elizabeth, I think I covered it. Great, thank you.
Okay, well, thank you. I'm trying to get to my slides. I can't get it to move. Oh dear. There we go. All right. So we promised an action plan. Your 90-day action plan. It doesn't have to be crazy complicated. And everyone knows, including OCR and HHS, everyone knows that compliance doesn't happen all at once, right? So, first 30 days, you get visibility. That's what we talked about from the beginning. You update your asset inventory, you create your map, you get your lists. The second 30 days, days 31 through 60, you fix the obvious things. And then finally, days 61 through 90, you build the structure. But since you will be keeping evidence along the way, that shouldn't be a really big lift. And again, you don't have to do it alone. There's lots of resources. Certainly, we could be a resource. This doesn't have to be the hardest thing ever. So just a little deeper in that day 1 through 30, get through visibility. What you'll end up with is an asset inventory, your patient info map, your business associate register. This is the evidence, right? In the now part, your backup success report, and your evidence structure for audits. Okay. So the now, first things first, figure out where you are and get your visibility. And then you'll know where to go in the next part. Remember that IT will list your tech. Whoever you have working with you, whatever partnership you have, maybe it's an individual, maybe it's you. You might be very tech savvy. Um, you'll do the mapping and listing of the device. So that's the first 30 days. And then the next 30 days, there we go. Fix the obvious gaps. And there's some things that, are going to get you a big bang for minimal buck. Turn on the two-step login, the multi-factor authorization. Get the security checkup run. Lock your files digitally. Update your software. And a lot of this can be automatic, but don't rely on that. Do not rely on that. And then again, the evidence that you'll have a login safety report. So your screenshot of encryption, which hopefully your IT can help you with. Your list of fixed security issues and patches, because remember, the auditor wants to know your progress, where you were, where you're going. And then your update on your list of updated systems. You're going to want to run at least one vulnerability scan. You're going to want to have somebody run a penetration test for you where they pretend to be a hacker of some kind. And again, you can get help for this. It doesn't have to be, $400,000 contract. We're not talking, this is very scalable. And then of course, put your structure around it. How does this hook in with governance, Tom?
Sure. So on the 60 to 90 day, 61 to 90 day slide, we're really talking about what that structure looks like. And as I mentioned earlier, that's where a lot of smaller organizations really struggle because they haven't had the exposure of developing and implementing any type of a governance type of a program. And if you think to the earlier slides, we talk about understanding what our assets are and how those assets are maintained, and then what are the threats that those assets face through the process. We're really trying to figure out what the risks are to those particular assets and consequently our data. So what do we have? Where are our vulnerabilities? Where do we need to try to figure out how to maintain these things a little bit better? What are the threats that we can anticipate? And then what is the impact of those threats? And if you understand that, and it's more process driven than anything, and you tap into the appropriate resources or resources within your organization to get an idea about what they see, so you're not making decisions in a silo, and you document that through the risk process, you can have the evidence to present to the assessors and to make better business decisions. Once you understand what that is, you can develop and create, approve appropriate policies. You can figure out through the poem, understand where your gaps are and how to measure those, and then schedule the checkups and test the response plans, look at the business associate agreements. But all those components are really tied into the governance model of it. So every month or every quarter, you're collectively looking at all these types of things. You're understanding how they're measured, where you need to be as an organization, and then implement small corrections to get to and meet your goals. And that process, that governance process, that is exactly what the auditors are going to want to look at, and that's how you're going to be measured from a maturity standpoint. And it's not a point in time. It's this is where we're starting. We're building all these kinds of things, and then we measure it and we make changes over time. And over the course of a few years, as you continue to move through this process, you'll become more mature in how you go about implementing these cybersecurity controls, because they're only going to advance, right? They're just going to get tighter and tighter over the years. And so establishing, excuse me, establishing that governance framework now, that's exactly the right thing to do. So.
Yeah. And just as an aside, a poem, which I had not worked with a whole lot before, is a plan of, oh, I just forgot what A is.
Plan of action and milestones.
Milestones. So it's
Yep.
basically your plan of care.
That's exactly what it is, right? You're through the risk assessment, you're taking a look at what it is that needs to be fixed. You're documenting that through the plan of action, a milestone document. You're assigning responsibilities and making small or in some cases significant changes to fill that gap. So, and that document, that plan of action, a milestone or poem document, the auditors are going to look at that and they can look at the history and
Right.
measure kind of where you started and what you determined through the risk assessment. Here are the steps that you need to take as an organization to fix it, who's responsible for it, and here's the time associated with what that fix needs to look like.
Yep.
So, yep.
Perfect. I am gonna go to, okay, so this is where this is one of the ways that Lionfish could help you. There's lots of ways. There is no one set way to do the governance. There's no one set way to keep track of it all. You can use spreadsheets. It can get a little cumbersome if you're putting it in lots of places, lots of times. Our platform has templates and checklists to keep you on track. It has workflows. It has some pre-written documents, status at a glance, all of that. And it's just basically to keep everything in one place so that it's easy to track. And so it's also easier for auditors to track. And I'm not gonna stop sharing yet. I'm just gonna go through all the slides real quick and then I can come back to that. So how do we make compliance manageable? You don't have to do it alone. You can. I am sure that everyone on this webinar is a very smart cookie. No doubt in my mind. You wouldn't be where you are otherwise. But you don't have to. You can break it down into small steps. You can get technical help. You can get governance. This is GRC, governance, risk, and compliance help. You just start small. You eat the elephant one bite at a time. Use templates, and you get expert help. You know, it sounds like it's a heavy lift. It's really not. So I hope that from here you can move forward with more confidence, that we've given you some clarity, it's not as confusing as it was, and that you know it's progress, it's not perfection. We're not expecting you to cure whatever is going on with your cybersecurity, but we do expect you to address it, to diagnose it, and to treat it, and to move forward. And again, you can do this in partnership, not isolation, and even HHC and OCR can be partners in this. So last slide. If you're ready to get started, you can schedule a readiness session with us. Having registered for this, you do get a 45-minute consultation with myself and Tom or one of our other compliance experts. We can review your current environment and your existing controls, how the new requirements apply to your specific situation, what your compliance readiness level, get together a 90-day plan for you, and talk about how the Cyber Tackle Box can support your compliance journey. Obviously, it's not an obligation. We hope you got something out of this webinar. We hope that you feel like you're better equipped to address the HIPAA 2025 rule and can move forward. Um, I'm going to stop sharing here so that hopefully I can see if you have questions and we can move forward with that. If you want to just, yeah, if you want to just raise your hand or speak up, go right ahead. No questions? Tom, you and I are good.
Elizabeth, this is Jeremy. I don't really have a question per se, other than saying that I think you broke this down very, very well. Both you and Tom you did give a lot more clarity to these controls. So thank you very much for that.
Yeah, you're welcome. Thanks, Jeremy. Anybody else? Was there something that was particularly sticky or something that you want to ask about your own situation? We may or may not have an answer, but we can certainly get back to you. Okay, well, I am going to, I hope I still have this up. Yeah, if you want to make an appointment, I'm going to put our link in the chat, and I'll also I'll send emails out if you want to make an appointment with us. Now I have to find the chat. Here it is.
It looks like there's a question now. Somebody
Oh,
put in the
great.
chat.
Yeah. Um, will we have recording available for the attendees? Yes, we will. You will get a recording. And oh, and I see Jenny Patel says, I'm starting a telehealth practice. Oh, and I have BAA signed with EMR and CRM. Is there anything else I need to do? Tom, do you have an idea around that?
Yeah, and so one of the things that you'll want to do is you'll want to make sure that your business partners are actually going through the real process of being compliant. So one of the things that is happening and trending within the cybersecurity industry is that organizations that partner, that sub-partner, those main organizations, they're being held accountable for what's going on with their business associates. So you share that risk. And so asking for evidence of some type, whether it's maybe it's a SOC 2 report or some other kind of reporting or authentication type of a tool or report that they're actually doing what they say that they're doing, you're going to lock that down. So if you have more questions about that, we can chat about that offline. But that's essentially what you want. You want to validate that they're doing what it is that they say that they're doing. Typically, that's a SOC 2 report, or maybe it's an ISO 27001 attestation or something along those lines. But yes.
That sounded like a lot of acronyms. Is there a plain English?
There is a plain English version of that. ISO 27001 is a standard, and it goes through some basic kinds of things like the things that we're talking about here. So are you updating your systems? Do you have policies and procedures? Those kinds of things. And the SOC 2 report is basically the same thing, but only at a much deeper level.
Thanks, Tom.
Yep. Thanks for that clarification.
And I see, yeah, you're welcome, Jenny. Will your slides be available for our review? I believe so. I think that's part of the recording. I don't know why that would not be. There was another question. Oh, Marcia asks, what is the template packet cost? So it's not just templates, it's it's the platform, and I will show, and it's basically a big organizer. I gotta find it. Hmm. Where'd it go? Shoot. Well, we can talk about this more. I mean, we'd love to talk to you, Marcia. And again, we're not going to be like, you have to use this, you have to do this our way. But we'd love to show you what we have. Which it's basically, if you're familiar with Monday.com or Asana, it's a management platform that has all of the controls, the HIPAA controls, tells you exactly what you need to do. Well, not what is required, not how you have to do it, for each of those controls. It has a place to store the evidence, and a place for the documentation. Nazarene asks, if we subscribe to a HIPAA compliant EHR, which is comprehensive, and work only through them, would that be sufficient?
Mhm. Well, I think there's some clarity around what sufficient really needs to be with that, and whether or not it's actually meeting the requirements of the new HIPAA rule. So if you have this subscription, you're working with an organization that has that, they should be able to produce those compliance reports for you to ensure that what's going on within their organization meets the standard. But keeping in mind that even though there is an electronic health record tool, for example, it sounds like it's a tool, so you're using some kind of a tool, there are still things that you're going to be responsible for within your organization, which might be patching or other kinds of things. So it likely is. I would ask them for attestation of some type, but also keep in mind that that's just part of the larger environment that you're working within.
Great. Thank you for that question, Nazarene. Anyone else? Yeah, you're welcome. These are great questions. And we can, again, we can speak with you more about your specific situation in the future. We would love to talk to you and help you out. Okay, no one else? Okay, we've got just a second. Let me move this over here. And I will share this screen now that I found it. I must have gotten rid of it by accident. All right. Oops. Tom, can you see that?
I see something at the bottom, but I don't fully see your screen.
You don't see my screen. Let's try that again. Thank you
I
all
could
for
see your screen.
Oh, you did? Oh, okay. Well, then let me try again. Okay, so this is the cyber tackle box, and I've set it up for HIPAA requirements. It's going to take a second to think about that. Okay, so here's the requirements here: breach notification rule, privacy rule. And so basically what this does is it gives you definitions, it shows you what is required for each thing, and then it gives you some training about it. There's places, if I go to administrative safeguards, business association contracts. Okay, so if I go there, so it tells us what all is required, implementation's objectives. Here's where we've got kind of a beginning policy for you, and you can get help with how you write the policy. Tools, what you could use, no tools needed for this because it's policy in a contract. Documentation, what supports it so it's all the references from HHS and OCR, and then some training on it as well if you needed, how do we do this? So this is just it's a big package for keeping track of everything. It has been designed for small to medium businesses. It's not meant to be an enterprise problem. But anyway, so we're almost at time. We've got about 5 more minutes. If anybody else has any other questions, I did put the appointment.
Yeah, so there was a question about a BAA for printers.
Perfect.
I think it depends on, what type of printer you have and who has access to that.
Mm.
So if you have repair organizations that come in and service that printer, and for those of you who don't know, oftentimes protected information is stored on a local hard drive within the printer or some other way, then yes, you're going to want to make sure that you've got appropriate agreements in place with those organizations.
Perfect. Thank you for that question. Ooh. Oh, I do not have 5 minutes. Okay. Yes, I just got a ping. I forgot that we need to actually get off right around now because we do have another webinar for managed service providers coming up. And so we need to open up that room as well. Thank you all so much. It has been such a pleasure being with you today. I'll get in touch with you by email. You're welcome to call us at any time, and we look forward to speaking with you in the future. Thanks a lot.
Thank you.